Namaskar. Welcome to Ahara Arugya Adhyatma, the light of Samskara. Today we have a very special orthopedic surgeon, Dr. Satish Nesri. He did his MBBS from KMC and MS from Jain Medical College, and now he is working in the Belgavi Medical College and Research Institute. And more than anything, he is an expert in ILIZARO. He is an international fellow of ILIZARO technique. And not only that, he's conducting the workshops to give the hands-on training to the other orthopedic surgeons. And also he has given many lectures on that. So today he's going to tell us who started this ILIZARO and when, in which instance, and then how it is beneficial through his presentation. Welcome, Dr. Satish ji.
Thank you, ma'am. Thank you for the invitation.
Please tell us the indication for ILIZARO and who was ILIZARO and how we started during the World War. Please show us through your presentation, sir.
Yes, ma'am. ILIZARO, the full name of ILIZARO is Gabriel Abramovich ILIZARO. He invented this ILIZARO technique in 1950 during his stay in Kurugan. Kurugan is a place in Russia where he was posted as a doctor for war-injured patients. So there, during while treating the war injured patients, he used the cycle rings and spikes and managed to build an external fixator which will be surrounding the limb. And during this process, he discovered that all his patients had recovered very well. And in this process, he also invented his own law of tension stress, where when the bone is gradually stretched under tension, a new bone grows. So this is known as law of tension stress.
Sir, can you show us the presentation so that the people can understand, sir, please?
Yes, ma'am.
Yes.
So this is the round external fixator. This is a ILIZARO fixator. You can see here we have cut the bone and gradually distracted it. There the new bone has formed. This is another example where we have cut the bone and gradually distracted the bone at 1 mm per day. And here you can see a new bone has formed. So there are several indications. This is one of the indication where bone lengthening has been done. You can see here there is a patient with 15 centimeter shortening of the right femur. So ILIZARO was applied for this right femur and gradually distracted. Now you can see after a certain period of time, both the length has been equalized and the patient is walking very comfortably with no limb length discrepancy. This is another indication where it is applied, ILIZARO is applied in an open fracture. Here you can see a very badly injured bone with soft tissue, muscles, everything exposed. ILIZARO has been applied for this patient. And you can see here all the exposed bone completely healed, soft tissue healed, all nerves and blood vessels also healed. So here you can see the patient is walking comfortably. This is after 12 months of the surgery. You can see preoperatively such a bad fracture has united and patient is walking very comfortably.
Yes.
This is another patient where patient had osteomyelitis of the lower end of tibia with deformity. He is a karate player. So he came to me with this condition. So ILIZARO was applied. And you can see he went back to play karate and won 3 consecutive gold medals in district level karate championship. These are all the magic of ILIZARO.
Excellent.
And this is another indication where it can be applied for a gangrene. You can see a smoker, when he smokes, he will be inhaling a lot of toxins.
Common. Yes.
Yes, ma'am. He inhaling toxins which will cause arthritis of the small vessels, leading to gangrene. So this patient, I applied ILIZARO and did a longitudinal corticotomy and gradually distracted the bone. So by doing
this is better
the
than
stem
amputation.
cells which are present in the bone. Yes, yes, ma'am. Amputation was done because the gangrene, once it happens, it cannot be revived. So we will
Okay.
excise the gangrenous part, but to prevent progression of the gangrene high above the toes, so we need to
Ah,
restore the blood supply to the particular part. So this is
part.
done by
Okay.
neovascularization technique of ILIZAROV, where the new
Okay.
blood vessels regenerate from the bone marrow and
Okay.
forms neoangiogenesis and helps in
Okay.
restoring the blood supply to the limb. So that's
Okay.
why that way we can save the limb going for
For
a
further extension of the amputation.
above ankle,
Okay.
above knee, below knee amputations.
Yes, sir.
So another indication where Elisero is commonly used is the infective non-union tibia. Here you can see a pouring pus. This patient had
Hmm.
multiple surgeries with plate and screws inside inside the leg, which
Hmm.
got infected.
Hmm.
So here we had to excise the dead bone. Excised
Hmm.
bone, the gap formed by excising the bone, we can
Hmm.
regenerate the new bone with the help of Ilizaro technique. So this is after
Okay.
1 year. You can see the bone has completely healed, pus has stopped, and patient is comfortably doing his routine activities. Another indication
Okay.
is a clubfoot, which is a very common condition in children. Usually, these children presents as a neglected clubfoot at around 6 to 8 years age. This
Hmm.
is a
Hmm.
patient with bilateral clubfoot. For
Hmm.
such patients, we can apply Ilizaro, which is a minimal invasive treatment for neglected
Okay.
CTEV. And here you
Okay.
can see the preoperative, how the patient is walking, he almost
Hmm.
walking over the ankle. And post-operatively,
Okay.
after 6 months, so walking very comfortably. He can wear shoes. He can
Okay.
play with the
Yeah.
normal children
Hmm.
happily. So this is another indication where it is used for a burns contracture, where the patient
Hmm.
is had severe burns during childhood.
Hmm.
Patient is walking on the
Hmm.
ankle with
Hmm.
180-degree turned. In such cases also
Okay.
we can apply Ilizaro, correct the deformity. Here we can see the
Hmm.
patient is walking with the plantigrade foot normally.
Hmm. Okay.
Another patient,
Okay.
same burns contracture, very severe grotesque deformity of the foot.
Hmm.
The
Almost
dorsum
it
of
has
the
turned
foot
up. Okay.
almost touching the anterior part of the tibia.
Hmm.
So in such cases, very severe deformity, we can apply
Hmm.
Elizaro and correct the deformity to the normal
Hmm.
and bring it to normal appearance.
Okay, sir.
So another indication we have is a cerebral palsy, very common in a premature child where there will be a hypoxic brain damage. And
Okay.
so in this patient,
They can have the
there
cerebral
will be
palsy and
multiple
the stiff legs.
deformities,
Yeah. Yes.
of the hip, knee, and ankle. In such
Hmm.
cases also we can apply Ilizaro and
Hmm.
correct the deformity. Now this patient, he is able to
Hmm. Walk
stand
and do his own
independently.
routine work. Hmm.
Routine works. Yes, ma'am.
Hmm.
And this is another patient, an adult patient who had a severe bent at the knee.
Hmm.
So for such patients also we can apply Ilizaro. This is a ring fixator. The leg
Hmm.
will be suspended inside the ring fixator, and
Hmm.
gradually the deformity will be corrected by after cutting the bone and gradually correcting the deformity. This is a
Okay. Okay.
post-operative deformity where the knee is looking almost exactly normal.
Yes. Normal. Normal.
Yes, ma'am. These are the
Okay,
indications
sir.
for Ilizaro.
Sir, thank you, thank you very much, sir. In fact, whatever the Ilizaro treatment you have shown in all these patients, it is like, the Sanjeevani, where there is no hope. You are bringing hope for them and bringing them back to the normal life. So, thank you very much, sir.
Thank you, ma'am. Thank you.